I'm Miss Shalita Taylor, and welcome to Joy in Our Town. Today, we're going to learn more about the immune system. My guest is Dr. Sunil Joshi, who is a board member for Florida Allergy, Asthma, and Immunology Society. How are you, Doctor?
Very good. Thank you for having me.
Good to have you here today. Dr. Joshi, what is immunology?
Well, immunology is basically the study of the immune system. So ways in which we can protect ourselves from infections that we get exposed to, but also the ways that our body may have too strong an immune system and then cause disease against our own cells, known as autoimmune diseases. And so immunology basically composes that entire field.
Okay. So that immune system, that word sometimes is so threatening. It's immunology, but it's the immune system.
Right. It is really nothing but the study of your health in the big picture.
What role does the immune system play in human health?
Well, the immune system is critical for human health. Without it, we certainly wouldn't survive. And so the immune system basically is what keeps us healthy, keeps certain pathogens such as viruses and bacteria from causing significant disease in our systems. Or if they do cause disease, the next time you get exposed to it, to prevent that disease from happening. So it really is critical for our survival as a species, is to have a strong and adaptive immune system.
That's a good word, adaptive. Please explain the difference between clinical immunology and classical immunology.
Yeah, so basically classical immunology is an old term. It's basically what people were looking at as the immune system even before Christ. You know, when some of the older literary people, in particular doctors or health providers back in those days, would look at people who were exposed to disease. And these people who may have had a very bad virus were then able to take care of other people who are developing the same disease because they developed immunity. And they'd say, okay, these people are immune to this particular problem. They can take care of those people. Didn't really understand what was going on or how that would affect them going forward, but they knew that there was some sort of an immunity that was built. That's, quote, classical immunity with no scientific background. Since then, over the last 1,000 years or so, science has developed to the point where we can now understand specifics of the immune system, how it works, and how it affects people and diseases. And that leads to more of a clinical picture, meaning what you and your doctor discuss at the bedside, how that immune system then relates to you as an individual. So that's clinical immunology versus the old classical immunology.
Okay, wonderful.
Kind of hard to explain the difference, but
that was very clear, because that makes sense, because we do become immune to certain things, and then it's like, well, why is this person not being affected in the same type of way?
And back, thousands of years ago, people understood that. They just didn't understand why. And now we understand why and how that affects you, and that's how we try to help keep people healthy.
Okay. What disorders and diseases are associated with this branch of biomedical science?
Well, so I mean, there are many different immune deficiencies. So people who may be born without the ability to have an adaptive immune system, so that they don't protect themselves from viruses or develop a way in which they can protect themselves in the future from these viruses or bacteria. And so there are immune deficiencies where people may not be able to survive unless we somehow help them with that part of their immune system. Also, if your immune system is working too hard to protect yourself, it may start to fight off against our own body cells, and that's called an autoimmune disease, which there are varying numbers of those as well. So the clinical immunology is a way in which our body keeps us healthy, but unfortunately sometimes it doesn't always work, and so it may make us sick so that we can't protect ourselves, or make us sick because we are overprotecting ourselves.
You gotta have that perfect balance.
That's right.
Right in the middle.
You're walking that fine line.
Yes. What are the differences or similarities between immunodeficiency and autoimmunity?
So that's very similar to what we were talking about. How does this hurt us to some extent? And so an immune deficiency is when the immune system is not doing its job, basically. And so the people with immune deficiencies are more likely to develop bacterial infections, sinus infections, pneumonia, bronchitis, gastroenteritis, things of that sort that can't even be life-threatening, especially at a very young age. Autoimmunity is the opposite. It's that your immune system is actually working fairly well, but now it's working so well that it's also looking at our own body and recognizing it as some sort of a pathogen and attacking it. And so common autoimmune diseases would be like lupus, for instance, or thyroid disease and rheumatoid arthritis, those types of things, or where your immune system is in overdrive for certain things, and it ends up causing disease in our body as well.
Okay. Wow. How common are misdiagnoses? This was totally what was on my mind. How common are misdiagnoses when it comes to ailments of the immune system?
I mean, they are fairly common, actually. Some people may live with an immune deficiency into their 20s or 30s before somebody recognizes that that may be what's happening. And one of the reasons is, you know, these diseases are not relatively common. So as healthcare providers are looking through issues going on with an individual person, they may overlook these uncommon things, and it only gets to the point where they may see a specialist, an immunologist, or an allergist who that's what we're thinking when we see patients, would identify something of that sort. So these things do go on for a while. Sometimes patients minimize symptoms, and as you're minimizing symptoms, the disease continues to progress. And so, yes, they can be misdiagnosed for years, if not decades at a time.
So there's not really a test that you can take, like at birth or during your regular checkups, where those types of things would actually come up?
Well, some congenital immune deficiencies are screened for at birth here in Florida. So as they, you know, puncture the toe of young children, they are screening for some of these immune deficiencies. So if a child has one of the severe combined immune deficiencies of young age, that should be picked up while they're in the hospital after birth. But some of the ones that develop as we get older, there is, I mean, typically when you're getting a screening test at your primary care provider, that's not in that litany of tests that are run. They're somewhat more expensive, so they're not typically used as a screening test. So the history, what's happening to you as an individual, is what should trigger the thought process of the healthcare provider to look into it.
And are there any types of common signs? You mentioned that there was some signs that are not very common, they go overlooked.
Well, yeah, for instance, infection. So people feel like if they're getting a sinus infection or bronchitis, it's no big deal. Everybody gets that every now and then. But suddenly you're getting them 6-8 times a year, which means if you look at the big picture, every 6 to 8 weeks you're on antibiotics. Well, something's not right. That should not be happening to you. We should be thinking about your immune system or some other process that may be going on, including allergies as well. If you know you have an autoimmune disease in which you're having joint pain, or you're waking up with neurologic symptoms or things that otherwise are unexplained, you should be thinking about a potential autoimmune disease that can tie a lot of these things together. And so, you know, and the reason why people don't is they think, oh, they blame it on something else and just kind of move on. And before you know it, it's been 3-4 years since it stared. And at that point, it may be a little bit more difficult to treat as well.
The weather, this is, you know, family things.
Absolutely. I was around my family, I got sick, or I bumped my knee, so it's hurting for the last 3 years. You know, those things happen to people.
What is the significance of immune strength?
Well, your immune strength is basically your ability to fight off disease. And so it's good to have a strong immune system so that we expect people to get sick once or twice a year with a virus just because you're around people and you pick things up. You should not be sickly with recurrent infections if your immune system is doing its job. And so one of the things that we recommend is that you also get vaccines when they're recommended so that you get the appropriate boost in your immune system. These are ways to stay healthy and to keep your immune system strong.
So what are some of these vaccines? Because I know a lot of people are skeptical about getting those types of things because they feel that it may have an adverse effect. So what are some of those?
Well, I mean, it's in particular in childhood, the measles, mumps, and rubella vaccine. There's a vaccine for streptococcal pneumonia, which is the most common cause of pneumonia. Of course, the flu shot is another big one, tetanus, those types of things. And people are skeptical, I think, for the wrong reasons, unfortunately. There's a lot of Hollywood press about vaccines that are really not true, and there actually have been studies from the CDC, the Centers of Disease Control, looking into that possibility that too many vaccines are hurting our children, when in fact that has not been proven to be true at all. In fact, the vaccines are typically what keep us healthy in this country. You know, we talked about before, measles was almost unheard of in the United States after the year of 2000. The CDC actually said that the United States was clear of the measles. And here in the last year, there have been over 300 cases, and a lot of that is because parents have chosen not to vaccinate their children. And so the disease comes back into this country, especially a transient country like the United States, and it starts to affect people who weren't vaccinated. And so vaccines can play a huge, huge role in keeping not just yourself healthy, but the public healthy.
True. And I haven't heard of an instance of a person, an adult, getting the chicken pox.
Right.
You know, and it's like, Chickenpox,
Right.
which, I've heard they can develop into shingles if it's in adults.
Oh, yes, absolutely. So yeah, chicken pox, basically, when somebody develops shingles as an adult, as an older person, it is the chicken pox virus that's recurring, basically. It just hides in a little nerve ending, and if your immune system takes a dip for whatever reason, it comes out, and it can be painful. And so there's a vaccine for shingles as well that is recommended for people over the age of 65. So these are all things to help keep us healthy and to keep your loved ones healthy as well.
Awesome. What is the purpose and mission of the Florida Allergy, Asthma, and Immunology Society?
So the Florida Allergy, Asthma, and Immunology Society is a group of allergists and immunologists here in the state of Florida that are board certified, that have gone through appropriate training to be allergists and immunologists. And our goal is to not only educate each other, to educate the providers, but also to educate the public and those who suffer with allergies about the importance of these diseases and the fact that there are treatment options and that there are a specialized group of individuals who can treat that, that do that every day of their lives and try to stay cutting edge in terms of managing these conditions. And so the Florida Allergy Society gives us that conduit to make these things happen and to, to educate the community at large about these very common disease processes.
I was wondering, do you all have any types of programs or
We do. I mean, and we have medical education programs for the allergists in the state so they can get more CME credit, but also so that they can stay cutting edge, stay advanced, and know ways in which the newer treatment options for patients. We have done public education and asthma screenings through the years as well. And so these are things we'd like to do more of, and hopefully we'll be able to grow not just in Jacksonville, but also all the way down into South Florida and places where people really do need specialized care, in particular for asthma.
And so is this type of literature or these programs available? I think of my nephew. He has many allergies.
Yeah,
and unfortunately, you don't know that you have the allergy until you have an allergic reaction.
Right.
And so you try and, supplement with the foods and formulas and things like that. And you think you're actually getting the right formulas, but then it's laced in, milk or whatever. And so it's like, this isn't helping. So what can parents do to get some information on?
Yeah, I think that is important because sometimes parents start to self-treat or they take advice of other healthcare providers who may or may not be as well versed in these types of things as someone who does it every day. And so if you go to the Florida Allergy, Asthma, Immunology website, they do list allergists that are part of that society, not just in Northeast Florida, but in the Panhandle, South Florida, Central Florida, all throughout the state, where you would have a list of board-certified allergists who are comfortable treating these types of conditions. And so I would go there first, go to the website. There's also information on that website for parents as well, and links to other websites as well. But ultimately, seeing an expert in the field, I think, would be very helpful.
Best thing. Well, thank you, Dr. Joshi. And don't you go away. We'll be right back with more Joy in Our Town. Welcome back. If you do not suffer from allergies, then consider yourself blessed because many local residents are not as fortunate. My guest today is Sunil Joshi, who is a board member for the Florida Allergy, Asthma, and Immunology Society and has remained for this discussion. Hello again.
Good to see you.
You as well. All right, Dr. Joshi, what exactly is an allergy?
Well, basically, an allergy is your immune system reacting against something that is normal in the environment that it should typically not react against, such as oak tree pollen or dust mites or peanut or dog or cat. Our immune system, again, reacts against viruses and things of this sort, which is normal. When it starts to react against other things that we call ubiquitous, meaning they're all in the environment all the time, then it's doing something wrong. It's reacting in a way that it typically shouldn't, and it causes symptoms of typical allergies.
Okay. What are the most common types of allergies in our area?
Well, here, if we're looking for environmental allergies, the most common thing is dust mites, for sure, because dust mites are indoor allergens, and about 25% of the population is allergic to dust mites, which are little insects that hide inside house dust. They're so small you can barely see them, but they're in our carpeting, they're in our mattress and our pillows and our box spring and upholstered furniture. if you don't have allergies to them, you don't really care about them because you can't see them.
Right.
Those who do certainly get affected. So that's the most common indoor allergen. The most common outdoor allergen, which is what most people tend to be worried about, is oak tree pollen. So our tree pollen season is clearly our worst time of the year,
Yes.
the spring, and oak trees tend to pollinate from February until about Mother's Day. So we have about 3 months of misery at times if people are allergic to these things. And so oak trees are kind of our big culprit.
Okay, and I'm definitely can attest to that. What are the causes of allergies?
Well, again, the typical causes are, depending on what we're talking about, are pollens, so the proteins that come from tree pollen, grass pollen, and weed pollen. Mold can also cause allergies around here, especially in the fall when the sun isn't as strong, but it's still wet outside. And then indoor things like dust mites, as we already talked about, but animals, dogs and cats, cockroaches are also a very common cause of allergies on the eastern seaboard, and feathers that can be in pillows and birds and things of that sort. Those are the most common causes of, quote, hay fever or environmental allergies, not just in this area, but for most of the country.
Why do some people develop allergies later as adults?
Yeah, that's a good question, and we don't really know the answer to that. Why do allergies affect you now and not before, or affect you 10 years from now and not today? It's a good question that we don't understand completely, but it is true that you do not have to have allergy symptoms or asthma or any of those things as a child, and you can develop them as an adult. And the old thinking was that you have allergies as a child and you outgrow them as an adult.
Right.
But that is typically not the case anymore.
Yeah.
We see a lot of patients who come in with their symptoms adult onset. And so changing your environment, things of that sort may be contributing. Smoking certainly does increase your risk of developing allergies as an adult. So your environment may play a role, but we don't know that for sure.
Okay. People often define pollen as the yellow stuff on our cars.
Right.
However, what is pollen?
Well, the yellow stuff on our cars is pollen, but there are a lot of other pollens out there that you cannot see. So what you do see on your car, that yellow stuff, is from the pine trees, and that is pine tree pollen, which actually does not cause people a lot of trouble because it's so big. It actually doesn't get into our airway or affect our immune system. It's what else is pollinating at the same time that causes a lot of the issues. And so you see the yellow pollen, oh my gosh, my allergies are out of control. It's because of that stuff.
Yeah.
Well, that stuff is a marker of the other stuff that's coming out that you cannot see that is very likely causing you your disease process. And so the tree pollens, which come out that time of the year, most of them cannot be seen, including oak tree.
Okay.
And that's what's causing people to be sick, not so much the yellow stuff that you see
So
on your
touching it
cars.
is okay. And
I still wouldn't touch it,
Okay.
but certainly because it'll have all the other pollen in it also. It's all
True.
trapped in there together. And so you want to try to stay away from it,
Yeah.
but I wouldn't blame it directly just on the yellow pollen. That's just a marker of when you really need to be in
Beware.
control of your allergies.
Okay. Please explain the difference between allergies and a common cold.
Okay, and another good question, because sometimes it's really hard to know the difference. Okay, typically somebody with hay fever or classic allergies will have itchy eyes, watery eyes, red eyes, runny nose, sneezing, and itchy, stuffy nose.
Okay.
Classic hay fever symptoms. Somebody with a cold may feel a low-grade temperature, may have watery eyes, red eyes, nasal congestion, and runny nose, but typically don't get as much itching inside of their nose or their eyes or their throat. But that's not always the case. I mean, so it can go either way. And so a head cold is usually associated with a fever and muscle aches and body aches and goes away within 7 to 10 days. Environmental allergies can last the entire season, and so it becomes hard to know when it's happening, but sometimes if you go see a physician, they can look at you and examine you and be able to tell the difference relatively quickly. So if you're not sure, discuss that with your primary care provider.
What is the best method of testing for allergies? And I guess
there are multiple different ways to test for allergies. There's a skin test and there's also a blood test. The skin test is the preferred method of testing for environmental allergens. Number one, because it's a little less expensive, it's significantly less expensive than a blood test in the big picture. So as we try to keep healthcare costs down, I got to keep that in mind. And if you're doing a test on somebody, when you're doing it on the person itself, it is much more significant than when you're doing it in the lab. So when you draw blood and you're checking it in the lab and looking for allergens, how clinically relevant is that? When you see it on your skin and you say, oh my gosh, I'm so allergic to oak tree pollen that I've got this huge hive on my arm, Yeah, it gives you a little more of an idea that this person is highly sensitive to this particular product. So skin testing and blood testing are two different ways of evaluating allergies. We prefer skin testing.
Okay. What are some treatments for children and adults?
Well, number one is avoidance. So if you are allergic to something, the best thing to do is to avoid it. You know, obviously it makes sense.
Yeah.
Not that easy to do, though, if your kids are playing soccer and baseball and basketball and they're outdoors during the pollen season. So we give avoidance measure strategies, taking showers at night, trying to minimize outdoor activities. Some of that's practical, sometimes it's not. Then medications can certainly be helpful. Nasal sprays have been shown to be the most helpful at treating nasal allergies, nasal steroids, and nasal antihistamines as well. But some people don't like to take those, and so then we go to antihistamines, you know, in terms of pills, and other prescription allergy medications that can be taken orally can also be helpful. Most of the time we do them in combination, so that we're using things together. Other people want to try to get rid of their allergies, and so in that scenario there's something called immunotherapy, where we actually can deviate the immune system away from reacting to viruses and start to react, away from reacting to allergens, and start to react in more of a benign manner towards these things. That's what you hear of as allergy shots, or even allergy drops nowadays, ways in which you can divert your immune system away from the allergic cascade and then eventually become desensitized and tolerant, so you can have a quote-unquote cure of your allergies with desensitization.
Wow. Now, I've heard people using humidifiers to kind of clear the air of whatever.
Yeah, so
pollens or
humidifiers
things.
will add humidity to your airway, and a lot of times humidity to the airway helps you breathe. It helps your nose clear up, may allow you to move mucus a little bit better. So humidity in the airways is not always a bad thing, and it certainly can be a good thing. The problem with that is, if, again, 25% of the population is allergic to dust mites, okay? The more humid the environment, the more dust mites grow and develop. And so if we have a humidifier in a room of a child with a dust mite allergy, just because their nose is congested, we're very likely increasing the dust mite population, which can then make their allergies worse. So if we're worried about adding fluid to the airway, we recommend doing a saltwater spray, like nasal saline. Just a couple sprays of that will probably add more humidity to your nose than humidifying the entire room would, which could, of course, have negative effects as well.
Okay, okay. Glad you said that. Do allergies have different treatments? And please explain.
Yeah, different allergies have different treatments. In particular, if we're doing allergy shots or immunotherapy, we would treat specifically for what the person is allergic to in the vaccine that they receive. Food allergies are treated a lot differently than environmental allergies, because with food allergies, you really have to avoid the food. And it's critical that you do. And if you ingested the food by mistake, you have to have emergency medications available and an emergency plan available to treat that appropriately. For environmental allergens, it's very rare that somebody gets such a severe reaction to oak tree pollen or dust mites that they go into anaphylaxis, which is a severe allergic reaction. Whereas with food allergies, that's very common.
How can people offset the onset of allergies?
If your genetic structure is set up for you to develop allergies, you know, you're going to go down that path most likely. Okay, there are some studies that suggest children who are at increased risk of developing a food allergy, we may be able to prevent that food allergy with early introduction of the food, in particular peanuts. Recent studies have suggested that. But again, all of that needs to be discussed with the healthcare provider and not done on your own, because again, you could also be hurting the child if you do it incorrectly. But in terms of preventing the allergies long term, it's really hard to know if there is a tried and true way of doing it that isn't wasting your money, unfortunately.
What are some things that they can do to suppress as many types of negative outsets that can cause?
If you know that your child is suffering from allergies and has a lot of trouble when they're outdoors in the environment, they should be on medications. I mean, they definitely should be pre-treated so that that you're preventing their symptoms. Let them go outside and play. Let them go to the park. Let them go to the water park and the slides and the roller coasters.
They don't have to be in that bubble.
They don't. Absolutely, they should go out and enjoy themselves. And it should be our job to try and keep them healthy so that they can have the quality of life that we all want them to have. And so allow them to go out and play and do what they need to, and let's try to manage it appropriately. But you want to manage it before their symptoms start. So you want to always be proactive so that they're on medications before the season, or ultimately do immunotherapy so that you're getting rid of their allergies during that time as well. And so being proactive is always better than being reactive.
And that seems to be so much more cost effective, because some parents can think in the opposite way. Well, I
Yes.
don't want you to get sick, so stay inside.
Yes.
As opposed to, let me give you medication so that the result of the outset of the allergy won't be as bad.
Yeah, being proactive has multiple benefits. Number one, they're outdoors doing the things that we did when we were kids that kept us healthy. Number two, if you're being proactive with your medications, you're also preventing them potentially from developing sinus infections, bronchitis, or pneumonia, which also keeps them out of the doctor's office and which also keeps them out of the hospital. So you're minimizing your cost of health care as well if you're proactive at preventing some of these symptoms to begin with, and if you're outdoors playing, you don't develop the obesity and all these things that affect you down the road. So all of it is important. Being proactive to prevent allergies can allow your kids to develop appropriately through the years as well.
Awesome. Dr. Joshi, thank you so much.
No, my pleasure. This was great.
Gave us so much information. And thank you all for watching Joy in Our Town. You go out and you make it a fabulous day.
Thank you for watching Joy in Our Town. For more information about Florida Allergy, Asthma, and Immunology Society, please call area code 904-765-7702.